Study with Artemis Inc. podcast. This information was produced with the assistance of AI-generated content. Illustrative case studies. Emotional insights from journaling about self-awareness in the modern age. Disclaimer. This document presents fictional case studies developed for illustrative purposes. The individuals, scenarios, and outcomes described herein are entirely products of imagination and do not represent real persons, events, or actual research findings. Any resemblance to real individuals, living or deceased, is purely coincidental. This content is intended solely for educational and conceptual exploration and should not be interpreted as factual data or professional advice. Introduction. In an increasingly complex and rapidly evolving modern age, the cultivation of self-awareness has become a critical component of personal well-being, professional efficacy, and adaptive resilience. Journaling, as a structured reflective practice, offers a unique pathway to explore internal landscapes, identify emotional patterns, and foster deeper insights into one's thoughts, feelings, and behaviors. This document presents 3 fictional case studies illustrating how diverse individuals, through consistent journaling, gain significant emotional insights contributing to enhanced self-awareness and improved life outcomes. Case Study 1. The College Student. Subject Profile. Name: Alex Chen, fictional, 20. Occupation: undergraduate student, pursuing a Bachelor of Science in Computer Science. Context: navigating academic pressures, professional development, and collaborative project environments typical of early adulthood. Journaling practice and emotional insights. Alex initiated journaling during his sophomore year, primarily as a means to manage stress and organize his thoughts amidst a demanding academic schedule. His initial entries were largely utilitarian, detailing assignments and deadlines. Over time, encouraged by a mental wellness seminar, he began incorporating reflective prompts. A significant insight emerged when Alex consistently noted feelings of inadequacy and anxiety related to group projects, despite strong individual performance. Through journaling, he identified a recurring pattern. He would meticulously review his own contributions, but then become overwhelmed by perceived deficiencies when comparing his ideas and output to peers, particularly those with more vocal contributions. His journal became a space to articulate these anxieties without judgment. He wrote, "It's not just about the code, it's about feeling like I'm not smart enough or fast enough compared to others, even when my work is solid. I keep replaying discussions where I felt my contributions were overlooked." This consistent self-observation revealed a deep-seated imposter syndrome. He recognized that his anxiety stemmed less from actual performance, and more from an internal narrative of self-doubt and a tendency to externalize validation for his intellectual contributions. Impact on self-awareness. This realization allowed Alex to reframe his approach to collaborative work. Instead of fixating on external validation for his ideas, he began to focus on his internal metrics of success and to actively challenge his negative self-talk within his journal. He started documenting instances where he did contribute effectively and where his ideas were valued, creating a counter-narrative. This shift led to a reduction in anxiety, improved articulation of his ideas, and more effective engagement in collaborative problem-solving within group settings. His journaling evolved from a stress management tool to a powerful mechanism for cognitive restructuring and self-affirmation regarding his intellectual capacity. Case Study 2. The Middle School Male Teacher. Subject Profile. Name: David Miller, fictional, 45. Occupation: veteran middle school history teacher. Context: experiencing increased professional burnout, particularly related to classroom management and evolving student engagement strategies. Journaling practice and emotional insights. David began journaling at the suggestion of his therapist, seeking an outlet for the frustrations accumulating from his demanding profession. His entries initially detailed specific challenging classroom incidents and his immediate emotional reactions, e.g., felt exasperated today with the 7th grader's lack of focus. Through consistent journaling, a deeper pattern emerged beyond individual incidents. David observed that his most significant emotional distress wasn't solely from student misbehavior, but from his reaction to it. Specifically, a feeling of personal failure when he couldn't immediately control the classroom environment. He wrote, "I take it so personally when they don't respond. It feels like a direct indictment of my teaching, even though I know logically it's often about their developmental stage or external factors. My anger is really disappointment in myself." This recurring theme highlighted a perfectionistic tendency and an over-identification with student outcomes. He realized his emotional well-being was too heavily tied to external validation from student compliance, rather than his intrinsic effort and pedagogical approach. Impact on self-awareness. This insight allowed David to differentiate between his professional responsibility and his personal emotional investment. He began to use his journal to process his emotional responses before reacting in the classroom, fostering a more measured and empathetic approach to student discipline. He started journaling about successful strategies, even small wins, and reflecting on his own resilience. This practice enabled him to detach from the immediate emotional impact of challenging moments, leading to a more sustainable and less emotionally draining teaching experience. He developed greater self-compassion and a more realistic appraisal of his influence, which also enabled him to more openly collaborate with colleagues on innovative teaching ideas. Case Study 3. The Female Doctor. Subject Profile. Name: Dr. Sarah Kahn, fictional, 38. Occupation: emergency room physician. Context: high-stress environment, critical decision-making, frequent exposure to trauma, and managing work-life balance. Journaling practice and emotional insights. Dr. Kahn adopted journaling as a means to decompress after particularly demanding shifts, initially focusing on cathartic release of stress and recounting clinical scenarios. Her early entries often contained raw emotional expressions of exhaustion, frustration, and grief. As her practice evolved, she noticed a recurring theme in her reflections: a profound sense of guilt and self-blame following cases with adverse outcomes, even when all clinical protocols were followed. She wrote, "Despite knowing I did everything by the book, the what-ifs consume me. I feel personally responsible for every negative turn, as if I could have somehow bent reality to change the outcome. This feeling of inadequacy is draining me." This consistent self-analysis revealed a deep-seated professional perfectionism and a challenge in accepting the inherent limitations and uncertainties of medicine. She recognized that her emotional burden was exacerbated by an inability to compartmentalize and a tendency to internalize patient outcomes beyond her control. Impact on self-awareness. This critical insight prompted Dr. Kahn to use her journal not just for emotional release, but for structured debriefing and cognitive restructuring. She began to explicitly challenge her self-blaming thoughts, writing down factual accounts of her actions and comparing them against established best practices. She also started journaling about the emotional toll of her profession and actively identifying strategies for emotional replenishment outside of work. This led to a more realistic understanding of her professional boundaries and a healthier emotional detachment necessary for sustained practice in a high-stakes environment. Her journaling became a vital tool for processing professional trauma, fostering resilience, and maintaining mental health in a demanding career, which in turn allowed her to engage more effectively in collaborative discussions about patient care strategies. Conclusion. These fictional case studies underscore the profound utility of journaling as a tool for cultivating self-awareness across diverse professional and personal contexts. Whether navigating academic pressures, managing classroom dynamics, or coping with the emotional demands of critical care, consistent reflective writing enables individuals to identify emotional patterns, recognize recurring emotional responses and their triggers, uncover underlying beliefs, expose deeply held, often subconscious, beliefs that drive behavior and emotional reactions, process experiences, provide a safe space to process complex emotions and challenging events, foster cognitive restructuring, challenge unhelpful thought patterns and develop more adaptive perspectives, enhance self-compassion, cultivate a more understanding and supportive relationship with oneself. In the modern age, where external stimuli and demands are constant, the intentional practice of journaling offers an invaluable internal compass, guiding individuals toward greater emotional intelligence, resilience, and a more profound understanding of their authentic selves. This enhanced self-awareness also facilitates more productive collaboration on ideas, as individuals gain clarity on their own contributions and how to best engage with others professionally. Copyright 2025.